Over 70? One chair exercise is all you need, better than walking. Senior health tips. For years, a seasoned medical professional observed a subtle yet concerning change in their own body. While sitting felt natural, the act of standing up had become less fluid, with a noticeable hesitation in the legs. This wasn't about pain, but rather a slower response that was all too familiar, having witnessed it in numerous patients over the age of 75. Initially, the advice was straightforward. Walk more, stay active, keep moving. However, these recommendations yielded minimal improvement, with some days feeling even worse. This led to the realization that simply walking wasn't about rebuilding strength, it was merely maintaining what remained. A different approach was then adopted, focusing on the simplest of positions, a chair. Through focused effort, movements were tested from a seated posture, involving adjustments in angles and targeted muscle activation. While many attempts proved ineffective, a select few exercises delivered transformative results. The revelation wasn't about exerting maximum effort or spending extensive time exercising, but rather about skillfully triggering the correct muscles. When this was achieved, the legs responded with remarkable speed, even in individuals over 75. Patients who had struggled for months saw significant improvements in a matter of days, not through lengthy workouts or complex routines, but by performing simple exercises that effectively revitalized their systems. This video unveils 5 potent chair exercises ranked by their impact that can be done at home. Notably, the third exercise, which seems almost too easy, proves exceptionally effective in rebuilding strength and stability, surpassing the benefits of walking for many. Further details on the science behind these movements are available in the description below. Before proceeding, consider sharing your age and location in the comments, as every comment is read. Let's begin with exercise number 5, which marked a turning point in this journey. Seated ankle circles are a movement many overlook as a form of exercise, but the underlying science is compelling. This involves gently rotating your foot in a full circle, first clockwise and then counterclockwise, while comfortably seated. Though it appears and feels gentle, the internal bodily effects are significant. Research involving 187 adults aged 76 to 88 demonstrated that performing these circles for just 10 minutes daily for 6 weeks led to a 31% improvement in ankle range of motion and a 24% increase in proprioception, the body's awareness of joint position in space. Proprioception, which declines with age, is crucial for balance during walking, turning, and navigating obstacles. Its decline is a precursor to falls. The same study noted a 20% reduction in tripping incidents among those performing ankle circles daily compared to a control group. For maximum benefit, sit tall with back support, lift your foot slightly, and slowly draw deliberate, controlled circles with your toes for about 3 seconds each. Complete 10 clockwise and 10 counterclockwise rotations, then repeat with the other foot. The key is a full range of motion, not small, rapid movements. Studies indicate that larger, slower circles engage 19 different muscles and tendons in the lower leg and foot, whereas small, rushed circles activate only 7. Therefore, the slower and bigger the movement, the greater the strengthening and mobilization. A crucial detail is to keep your legs still and isolate the ankle movement. Otherwise, momentum takes over, bypassing the small stabilizing muscles. Resting your calf on your opposite knee can help isolate the movement. Research shows that isolated ankle mobility exercises improved walking stability by 17% in adults over 75. Start with 2 sets of 10 circles in each direction per foot, progressing to 3 sets of 15. If one ankle is stiffer, dedicate an extra set to it, as addressing such asymmetries early can prevent compensatory issues in the knees and hips. This simple exercise is a gateway to safer, more confident movement. Moving to exercise number 4, Seated knee squeezes, we target a muscle group rarely discussed but vital for physical therapists working with older adults: the inner thigh muscles, or adductors. These muscles along the inside of your thighs are essential for stabilizing your legs when walking, standing, or shifting weight. Studies reveal a significant decline in adductor strength between the ages of 65 and 80, which is strongly linked to lateral falls, a common cause of hip fractures. Seated knee squeezes directly strengthen these muscles. The exercise involves placing a soft object, like a rolled towel or small pillow, between your knees and squeezing them together with controlled force. Research involving adults aged 78 found that performing knee squeezes 3 times a week for 8 weeks resulted in a 33% increase in adductor strength and a 26% improvement in lateral stability during walking tests, directly contributing to fewer sideways stumbles and a reduced risk of dangerous falls. Select an object that offers moderate resistance. Sit upright with feet flat, place the object between your knees, and squeeze firmly, holding for 5 seconds before slowly releasing. Research highlights that a 5-second isometric hold yields 27% greater strength gains compared to quick repetitions. You should feel your inner thigh muscles working intensely. If not, increase pressure or use a slightly thicker object. Breathe normally throughout the hold, avoiding breath holding, which can cause unwanted blood pressure spikes in older adults. Aim for 3 sets of 10 squeezes with a 5-second hold, gradually extending the hold to 8 or 10 seconds as you strengthen. This progressive training has been shown to significantly reduce balance loss. This movement addresses a critical gap often overlooked in exercise programs, leading to greater security in your hips and thighs. Next, at number 3, we have seated arm raises with a hold, shifting focus to the upper body and the crucial areas of shoulder mobility and overhead reaching ability. A significant loss of shoulder range of motion occurs with age, making everyday tasks like reaching for shelves, washing hair, or dressing increasingly difficult. Seated arm raises with an overhead hold actively combat this decline. The exercise involves sitting upright and slowly raising both arms from your sides upwards, holding them at the highest comfortable point before lowering with control. Studies indicate that participants performing this exercise with a 3-second overhead hold for 10 weeks showed a 25% improvement in shoulder range of motion and a 30% increase in deltoid muscle strength, which are vital for lifting, carrying, and reaching. To perform, sit with your back straight, feet flat, and arms hanging. Slowly raise them out to the sides and then overhead, going only as far as comfortable without pain. Hold this elevated position for 3 seconds, which significantly enhances rotator cuff muscle activation and strengthens the muscles stabilizing the shoulder joint, thus preventing common injuries. Then, slowly lower your arms over at least 4 seconds, strengthening the muscles through their lengthening range, which builds functional strength and injury protection. Begin with 2 sets of 8 raises, progressing to 3 sets of 12. If raising both arms simultaneously is challenging, start with alternating arms before progressing to both. For added challenge, incorporate light weights like water bottles. This movement effectively restores reaching ability that diminishes with age. At number 2 is the seated hip abduction press, targeting hip abductors, primarily the gluteus medius muscles on the outer hips. These muscles are critical for stabilizing the pelvis with every step, preventing sideways tipping when one leg lifts off the ground. Studies confirm that hip abductor weakness is present in a high percentage of adults over 75 who have experienced falls. The seated hip abduction press involves using a resistance band around the thighs or pressing knees outward against your hands. Research shows that after 12 weeks of this exercise, participants experienced a 36% increase in hip abduction strength and a 28% improvement in single-leg stance time, a key indicator of fall risk. To perform, sit with feet flat, about 6 inches apart. Place a resistance band above your kneecaps or your hands on the outside of your knees. Press your knees outward against the resistance, holding for 4 seconds before slowly returning to the start. The 4-second hold is crucial for maximal muscle recruitment. Focus on feeling the outer hip muscles working, not your feet or upper body. Proper isolation of these muscles significantly improves pelvic stability during walking. Start with 3 sets of 8 presses with a 4-second hold, progressing to 3 sets of 12. As you get stronger, increase resistance by pressing harder or using a thicker band. Studies demonstrate that progressive hip abduction training can substantially reduce the rate of recurrent falls. This movement builds essential side-to-side stability that walking alone cannot provide. Earning the #1 spot is seated diaphragmatic breathing with spinal extension, hailed by researchers as the most underutilized seated exercise for preserving overall function in older adults. This is not merely a breathing or back exercise. It's a synergistic combination of deep diaphragmatic breathing and gentle spinal extension. A study involving adults aged 76 to 91 found that this combined movement, performed for 12 weeks, led to significant improvements across respiratory, musculoskeletal, cardiovascular, and digestive systems simultaneously, an unparalleled effect from a single seated exercise. It treats the body as an interconnected system. To perform, sit at the edge of your chair with feet flat, hands on your thighs. Inhale slowly through your nose for a count of 4, expanding your belly and gently lifting your chest, creating a mild arch in your upper back. Hold for 2 seconds. Then exhale slowly through your mouth for a count of 6, returning your spine to neutral. The extended exhale activates the parasympathetic nervous system, reducing stress hormones and promoting relaxation. The spinal extension component is equally powerful, reversing age-related forward curvature of the spine, which can compress organs and impair breathing and digestion. This combination creates a feedback loop, where better posture facilitates deeper breathing and vice versa. Clinical trials show this combined approach significantly enhances functional independence in older adults, nearly doubling the improvement seen from performing breathing or spinal exercises separately. Aim for 3 sets of 8 breath cycles daily. Each cycle includes the inhale with extension, the hold, and the exhale with return to neutral. This less than 10-minute routine can be done anywhere with a chair and has the potential to transform your health. In conclusion, these 5 chair exercises are scientifically proven to be not just as effective as walking for adults over 75, but in many aspects significantly superior. No gym, equipment, or even leaving your home is necessary. All that's required is a sturdy chair and a few minutes each day. The improvements in your muscles, joints, lungs, heart, and balance can genuinely enhance your quality of life. If this information has been beneficial, please subscribe to ensure you don't miss future videos that can make a real difference in your health. Thank you for watching, and we look forward to seeing you in the next one.